our first spring forum of the semester, and we're excited to have you here. We are having a few technical difficulties, so there are people, participants, panelists who are will be able to address questions, but may not be actually seen in the video. But we're working through those technical difficulties. But what I would like to do is introduce our panelists because they are individuals who have been tasked with the responsibility in critical areas, and are here to answer your questions about our COVID response relative to the virus, both testing and vaccinations, and also questions about the spring planning and also summer and fall planning relative to academic and student affairs. So what I'd like to do is first introduce the panelists and then move into some questions for specific panelists that I think will be helpful in getting us started. So the panelists I will introduce in no particular order. They're all important to me and to the campus community. I'll start with Terry Martin, the Senior Vice Provost for Academic Affairs. Huda Sharaf, Medical Director of the Pat Walker Health Center. We have Flo Johnson, Assistant Vice Chancellor for University Housing. Steve Krogel, Associate Vice Chancellor for University Information Technology. Matt Mills, the Director of U of A Emergency Management. And Melissa Harwood-Rom, the Dean of Students. And so we'll go ahead and get started. And I like to start with Huda because she's the kind of person we come to learn more about the virus and, you know, what's the CDC saying about this, that, and the other. And also, I know there are lots of questions about testing and the vaccine. So Huda, why don't you just give us some opening remarks about those two issues, testing and the vaccine?
Sure, I'm happy to, Provost. So basically, you know, as far as what's in the news lately, the pandemic continues. Unfortunately, we're still adding to our active case counts and unfortunately, our death counts across the country. We are seeing a slight decline in cases and hospitalizations. That's, I think, more in the fact that we saw that surge following the holidays, Christmas, New Year's, and I think we're basically starting to see a decrease from that surge. So I think it's going to plateau. You know, we've had questions about, you know, is this an indication that of the vaccine, you know, people being vaccinated? Is that why we're seeing a decrease? And that's not the reason that we're seeing that now. I mean, hopefully we'll be seeing that in the coming months. But for now, it's just the surge that followed the holiday, just like we learned that this happened after the 4th of July, after Labor Day, and after Thanksgiving. The testing is pretty much consistent. It has not changed. Again, there's two major types of testing. You have your rapid test, and then you have what's called your PCR test. The rapid test is the test, as it's stated, that you get results back within about 15 to 20 minutes. But again, it's only to be used on people who have symptoms, and those symptoms concerning for possible COVID infection. PCR testing is a testing that we do. They're both nose swabs, both these types of tests, but the PCR test can be done on those with or without symptoms, and you typically will get results back within a day or two. That is actually the gold standard for COVID-19 infection detection. And so that has not changed. You know, initially we had issues with test supplies when the pandemic began. That's gotten a bit better. And so we still have a lot of capacity for testing at the Pat Walker Health Center, both for those with symptoms in our Garland garage and those without symptoms in our back parking lot. So, you know, the light at the end of the tunnel, the glimmer that we can all see is the vaccine. So obviously a lot of people are real excited about that, as they should be. More and more people should be excited about that. The only two vaccines currently on the market are Pfizer and Moderna. Those are the allocations to our state. Northwest Arkansas is seeing predominantly Pfizer. The main reason for that is because of the extreme cold temperatures that it requires. It requires ultra low freezers, and we have more of that capacity in this part of the states than in other portions of the state. So Pfizer vaccine and Moderna are both 2 doses. Pfizer is about 21 days apart and Moderna is about 28 days apart. And when completing those vaccine doses, it's about a 95% effective rate against fighting off the infection. The other thing I'll touch on just briefly too that's in the news is the variants. UK, South Africa, and Brazil, you're starting to hear about some mutations in COVID-19. But what I want to tell everyone is that the vaccines are still felt to be effective against these strains. You know, now that the vaccine platform has been established and discovered, if mild changes in the vaccine are needed moving forward, those are much more simple changes. Just like when we have to change our flu vaccine each season to cover different types of strains. So just for want folks to know that the Pfizer and Moderna vaccines are still effective. Moderna is talking about the potential of creating a booster maybe later on, if need be, but that is not necessary currently. And the last note is that everybody should get the vaccine once it's offered to them. And just because you have completed your vaccine series does not mean that you throw your masks away. It will take several months for us to reach herd immunity through vaccination. So it is imperative that we all continue to wear our masks, physically distance, and use frequent hand hygiene. There's a few minutes.
Thank you, Huda.
No problem.
Matt, since we're talking about vaccines and everyone needing to, wear their mask, and even when they get vaccines, I think we need to maybe talk a little bit about what the university is doing on the vaccination front. I know we had the clinic just this past Saturday, and we've sent out some surveys. So talk about that a little bit so that we can get some clarity about where we are with our vaccinations and the surveys as well.
Sure, I'd be happy to. So, I think one of the first things to mention, and Huda kind of touched on, is the vaccine right now is not the cure-all, but it is the best approach that we're at. So even though you get the vaccine, you can still get COVID, just like when you get the flu vaccine, you can still get the flu. So you would still have to be tested if you become symptomatic. But from the vaccine perspective, where we're at right now, we've had 2 clinics on campus, one on January 20th and one on January 23rd. Both of those clinics were partnered with Collier's Drugs. They came in, they provided the vaccine for us. We utilized our nursing students to administer the vaccine, which worked out great for us and worked out great for the students as well. And we're planning on, I just spoke with the pharmacist at Collier's, right now, February 10th and February 13th for the second doses of those vaccines. Obviously, they are reliant upon getting the vaccine from the state and ultimately from the federal government. So that's what we're planning on. You'll be getting an email. If you attended the vaccination clinic on the 20th, you'll get an email from me or from emergency management in general with a time window specific to that day. And then on the 13th, you should get an email and or text message from Collier's to be notified of the time that we're going to be doing the vaccine on that day, on the 13th. Last week, we were able to vaccinate roughly 1,000 people so far, both at our clinics as well as a drive-through clinic that Washington Regional has offered up for us, with spots varying for each week, the numbers varying each week. So right now, we don't believe that they'll have vaccine for clinics next week at the drive-through clinic, is what I've been told from Washington Regional. But as soon as those become more available, we'll send more emails out regarding your appointment time. We did send 2 separate surveys yesterday, one based on age. They were sent out. One was 49 and younger and one was 50 and above. For those 50 and above, A lot of questions came back as to how do I answer this as I've already received the first dose. The idea was that you would click on no, you would be giving 3 other options, one of which says I've already been vaccinated or I have begun the process. That lets us know that we don't need to send you a first dose email anymore. You could also click no and say that I don't want it, or that I prefer my dose go to somebody in a higher risk group at this point. What we will do with those surveys, specifically those that are 49 and younger, is that's the pool of names that we will send. Those that click yes, I want the vaccine, that's the pool of names we will send the next clinics to. At the end, we will make sure that we send one more, be it survey or email, touching base with everybody in case we missed anybody, that we want to make sure that we get you an opportunity to have that vaccine as well. So we started with the age prioritization and worked our way down. And I believe there was a news article released today about how the prioritization will move forward from here. So that's what we will continue to do. But those vaccines, or I'm sorry, those surveys are very important for us to identify who we need to send the first dose vaccine information to.
All right, thanks, Matt. Huda, we've got a bunch of questions about the vaccine and how it works. Does it really create immunity? What happens if you don't get the second dose in a timely fashion? Can you just touch on those quickly?
Sure. Just very quickly, and I want to dismiss some of the myths that are out there, is the way that the vaccine works is that, first off, it doesn't have live virus in it. So it's not going to give someone a COVID infection. So I just want to make sure that's very clear. What you keep hearing about is something called mRNA or messenger RNA. And what it is, basically, it is a part of the virus. It cannot cause an infection at all. It's not live. But that basically part is what's the instructions to create those spike proteins. You know, on every cartoon we've seen about coronavirus, you basically see this big sphere, and sticking out of it are all of these spikes. And those spikes are spike proteins. So what happens is when you get the vaccine, you basically have mRNA in that vaccine. It goes into the muscle in your upper arm. And then what happens is that messenger RNA goes to the muscle cells. And all that messenger RNA is that it's instructions telling the cell on how to make spike proteins. So once the cell sees that and basically uses its ribosomes to make the spike protein, and then the cell shows off its work by basically displaying the spike proteins on the surface, that messenger RNA and those instructions are destroyed. Nothing from that part of the vaccine lingers in your body. It does not interfere with your DNA. It does not enter your nucleus. It does not cause superpowers, although some people are disappointed by that. But it does cause these spike proteins. And so what happens then is your body says, wow, these spikes on this cell don't belong here. I need to start making antibodies. So your body creates an antibody army saying, you know, we got to get rid of these spike proteins. They don't belong here. And so that's how this vaccine works. So that way, in the coming weeks, so the coming months, if you're ever faced with a COVID infection that enters your body and your body's like, wait, this doesn't belong here, you've already got an army of antibodies that's ready to destroy it and to neutralize the virus. And so that's in very simple terms how the vaccine works. You know, there are very few contraindications to this vaccine. It does not have mercury. It does not contain aluminum. It does not have food allergens. So if you're allergic to eggs, you can still get this vaccine. If you have a weakened immune system for whatever reason, you can still get this vaccine. Now, obviously, you need to discuss this with your doctor who knows your history much better than I do. But again, it's not a live virus. So it's not like other types of vaccine that could potentially give someone with a weak immune system an infection. So again, I will talk to whoever will listen about the need for, once the vaccine is offered to your group, you need to get it. Now, folks are like, well, how about if I just get the first dose? I don't want to get the second dose. Well, it's kind of unclear of how much immunity you're going to get from that after that first dose. And so, maybe it's 55%, maybe it's a little bit higher. But in order to achieve the 95% effectiveness of the vaccine, you will get that approximately 1 week after completing your second dose of vaccination. And so that's what we need to be aiming for.
Thanks, Huda. Matt, there have been questions about the survey, and if you felt that there are people who feel that they answered it incorrectly because it was confusing. How will we deal with, these concerns about the survey instrument if it was not answered in a way consistent with what a person now understands?
So the important thing to note is anybody that has been vaccinated at one of our clinics, be it Washington Regional or on campus, we have captured your information, and you should have received a card that said your next dose will be on this date. That date, if you were on campus, will either be February 10th or February 13th, regardless of how you answered the survey. If you answered yes, then if you get a follow-up email, all you have to do is reply and say, I've already been vaccinated, or I'm already waiting for my second dose. Or if you answered no, it will not affect your ability to be dosed the second time. The only thing that would affect that ability is Colliers or Washington Regional not being able to go and have the vaccine available. That's something that is completely and totally out of our control. So if that, and we pray that that's not the case, and as of right now, we're planning on administering that second dose. But if that were to change, then we would let you know. The survey, we did change midstream because there was so much confusion. So we changed some of the language in there. Specifically, when you answered no, it asked if you had begun the process elsewhere. So we deleted the word elsewhere because there was some confusion as to elsewhere meaning off campus. So we did change that midstream to try to alleviate some of that. And the decline in the amount of emails that I've received today, I think helped some of that. But if you answered it incorrectly and you get a follow-up email, just tell us that you've already been vaccinated or that you had answered incorrectly and you don't want the vaccine or don't need it, and we'll make the adjustments from there.
Thank you, Matt. And we're receiving a number of questions, and as in the past, our intent is to make sure that anyone who asks a question, that there's a response that they receive an answer to their question. So if you don't get a response from the panel today, our intention is to get back with you to address your question. So what I'd like to do is just turn our attention to kind of the planning or the campus activities for a little bit. And if time permits, we can come back to the vaccine and issue because it's a hot topic, and Matt had breaking news, and that tends to make the topic even more important. But what I'd like to do is turn our attention to some of our other panelists, and I'd like to get Terry Martin to talk a little bit about where we are now in the semester with regards to campus planning. What does the summer and fall look like at this point? Terry?
Yes, we started the plans for the summer and the fall a few weeks ago when we thought there would be probably a lot more vaccinations. It's changing, it's a fluid situation. But right now, for what we're planning for the summer, is that we will have social distance classrooms with masks. We think that's still appropriate. We're going to try to have more face-to-face. Since we made that decision, things are fluid and changing. We're looking at considering some remote classes as well during the summer. For the fall, we had originally planned trying to be back to normal, having our normal classrooms fully operational just as normal. And as you know, we've made plans each semester, and the plans we make have been modified depending upon how the pandemic rolls out at that time. We are very fluid in how we can transition from one mode of delivery to another. But right now we're hoping to have, like I said, more face-to-face classrooms in the summer with social distancing and masks, And in the fall, we're hopeful to be back fully face-to-face. But, you know, in the last few days, there's been some question about when the students would actually receive the vaccine. When we first started, we were hopeful the students would be receiving vaccines in the summer. That's shifted to the fall. So we will keep monitoring this and changing as we need to, but we can shift and change the way we need to. But that's the plans for this summer and fall as we're looking at it right now.
All right, thank you, Terry. Melissa, I would like for you to just give us an update on how we're looking at events for the summer and fall right now. Where are we in that planning? I think we may be having some technical difficulties still with Melissa. If we are able to get her back on, then we'll have her address the events question. I'll move on to Flo. Flo, can you talk a little bit about housing? What is housing doing to prepare for the summer and the fall?
We're taking reservations for camps and conferences, and with the caveat that we don't know exactly what's taking place, but our plan right now is to go as normal with all the social distancing requirements in place and the requirements of wearing masks as well.
All right, thank you, Flo. Melissa, I see you. Is that an indication that we can hear you?
Can you hear me?
Yes, we can.
Great. Then my tech support will get paid. So how can I help, Provost?
Well, I'd like for you to just comment on where we are for events and engagements for the summer and fall. I know you're in the planning stage, but can you just talk a little bit about that?
Well, some of that will depend on how or if the Arkansas Department of Health further modifies their directives. But as things stand now, then any event in an indoor venue with over 10 people and members of the public would need to be approved by the Arkansas Department of Health. And I can help with that. Matt Mills can help with that. So if you're planning events like that for the summer and want to figure out what to do, you can go ahead and reach out to me. That, again, depends on any changes that are made between now and then. But outdoor events, you would apply to the events committee as per the policy exists now. And we would assist you with that. I think the complications are going to be if you have members of the public. And I think a lot of us are looking at events where incoming students and parents and family would be in attendance. So we will help you with that. And I would ask you to plan early and ask questions early, and that will enhance the chances that your event will be smoothly planned and approved as you wish for it to be.
Thank you, Melissa. Steve, multi-step authentication. Talk to us about it. Where are we? And how are we planning to roll this out?
So yeah, MFA, this is commonly known, is well underway. So we've started a rollout with faculty, staff, and students, student employees earlier this year, and now we're working to complete the rest of the student group. So we're doing that in phases. A number of students have been invited to be early opt-ins. So if students would like to opt in ahead of their assigned time, that is open and available. So we're encouraging that. For students that want to wait to be activated in their waves, we have, let's see, February 16th will be the final activation day for freshmen. So between now and the 16th of February will be the freshmen. Then the sophomores will be completed by March 2nd, March 16th for juniors, and March 30th for seniors. So we're doing them in ways that way. So far, we've got nearly 4,000 grad students that have already been activated for MFA. And for the grad students, January 19th was their first wave, and February 2nd was their second. So we're way ahead of the curve there. The other question I frequently get is, so what's under MFA? So why do I need it? So any cloud-based application that we're offering at this point will be under MFA. So that's things like Blackboard, Office 365, those sorts of things. So as you become activated for MFA, you'll need to use that to access all of our cloud-hosted services and eventually for enterprise-hosted services collectively. But that's one of the reasons we're doing this. And I sometimes use the analogy of this is sort of, think of this as the face mask for your computer. That this adds another factor to authentication. So if you have a compromised credential, and we have daily compromised credentials where people's usernames or passwords might have been compromised if they used them on a social media site or something. So adding this additional factor really helps provide protection for your accounts and access to your data, as well as protects the university.
So Steve, students use their iPhones for this. What happens if they don't have an iPhone?
Yeah, basically you need some kind of a portable device that's able to get a signal from the authenticator or the authentication application. So if you don't have, smartphones, you don't have, iPads or something like that that you can use for that, then we have a little key fob that you can put on your key ring called a YubiKey. And if students find themselves in need of a YubiKey because they don't have access to a cell phone or a device, then invite you to contact the help desk and create a ticket there for that. The students who need to have a YubiKey will put those in a special group, and we'll address that as we get to the end of the regular student activation. So it won't penalize you, if you don't go with your original wave, but we're going to do that as a group more towards the end, because that'll have a little bit of a different connection process than with your smartphones.
Thank you, Steve. Terry, last semester and last fall and in the spring, we modified the grading process a bit in response to some of the challenges that the students had. Where are we in that process now? Is that something that we're considering, or just talk a little bit about that?
We have received some requests from the ASG to modify the grading policy for the spring. I also understand that the Graduate Council has looked at some modifications and have some suggestions. Both of those ideas are right now with the Faculty Senate Executive Committee, and I'm sure will be coming to Faculty Senate for their recommendation. Those recommendations then will go to the Chancellor and the Provost for review to see. So I suspect we will have some modifications of the grading policy for this spring, but we're certainly trying to get it done earlier than we did late last fall. It was a little bit late before we heard from the different groups, but we've asked them to get to us, give us the information, and so we're looking at it now, and hopefully in the next few weeks we'll have some information about that.
Thank you, Terry. Matt, there have been questions about the logistical challenges to the vaccination rollout. Can you just talk a little bit about, why is there a challenge for the university in being a part of this? What are the fundamental challenges for our campus, our response?
Yeah, so the logistical aspect of trying to identify and vaccinate 9,000-ish people on our campus to start with is huge. So what we're trying to do is identify those in the high-risk populations first, starting with age. And that's what we've done through the first two clinics and the drive-through clinics. We focused on that. And then making sure that as inevitably there will be some folks who have slipped through the cracks, we get them plugged back into available spots as quickly as possible, which we've done this week. We just sent Thursday's drive-through clinic information out, and shortly later today, I'll send Fridays. So that will give us another roughly 450 vaccination slots for this week. that we were able to take part in. And then I've had a lot of questions with folks asking and emailing me directly about, well, I've got these specific underlying medical conditions or problems. Can I be bumped up on the list? Can I take a priority spot for that? And honestly, right now, we're not focusing on the pre-existing medical conditions. We're focusing on the high-risk groups, which will now include those that have a majority, if not all of their time in face-to-face contact, be that face-to-face instructors, facilities, housing, those types of individuals now that we've gotten below that 50 and above threshold. So it is extremely difficult to try to prioritize. And honestly, it is difficult for me when I get those emails because we want to help, but we have to prioritize those. The other thing that we've gotten a lot of questions about is, I've got an appointment. Can I just bring my wife or my dependents and get them vaccinated at the same time? And the simple and unfortunate answer is no. If they don't fall into the phase 1B category as identified by the Arkansas Department of Health and the governor, specifically for us, employees of the university, then we cannot allow them to be vaccinated. The pharmacist providing the vaccines or the clinic cannot allow them to be vaccinated at that point, because they have to verify that information that they are in fact phase 1B and within one of the groups within phase 1B to receive that vaccination.
Thanks, Matt. Huda, timing on the shots. If you receive a vaccination and you don't, for whatever reason, can't follow the Pfizer or the Moderna 21, 28-day time requirement, how should you manage that? Is it better to go sooner or later? How should you manage it?
So that was a very timely question. The CDC actually just published an updated information on January 22nd. So on Friday, guidance regarding that. So, the question we get a lot is, how about if, how late can you get that second dose? We know that ideally with Pfizer, you really shouldn't get it any earlier than the 21 days, although there is 2 or 3 day wiggle room there. And the same with Moderna being the 28 days. So the CDC updated their guidance and stated that you could go as long as 6 weeks between the 2 doses. That's not ideal. Obviously, they really truly do recommend, if at all possible, that you stay within the 21-day guideline for Pfizer and 28 days for Moderna. But there's going to be a lot of variables that can happen in that time frame, and so they're trying to allow for that. I think that that's perfectly fine. We do that with other types of vaccines that are series vaccines. Hepatitis is that way. You can actually go longer between doses with that series. So right now the CDC has stated up to 6 weeks between 2 doses.
Okay. Thank you, Huda. Matt, back to you. What happens if you are on campus but you didn't get a survey? How do you remedy that problem?
So we pulled the survey information directly from HR with Debbie's help, which was great, and then sent that out through IT. So if you did not receive a survey and you think you should have, just email me. We will double check our list to make sure that you're on that list that should have received one, and then we'll forward you the survey.
Okay, thank you. Flo, what about occupancy limits for residence halls? Have there been any determinations for the summer camps and conferences?
Not by numbers, just by the fact of keeping the social distancing, and similar to what we do during the school year. But it's still in the planning mode. So we should probably have that pretty well worked out here in the next 30 to 60 days.
Okay. Thank you, Flo. All right, what I'd like to do is Steve, could you talk a little bit about any challenges you've had with with our online or remote delivery this semester? What have we learned from Zoom? How is Zoom better than it was when it was first implemented? Could you talk a little bit about that? I know our students prefer that as the platform of choice. So could you just talk about that a little bit?
Sure. So number of things. So I think when Zoom first came out, I mean, obviously having multiple windows like you're seeing today is certainly was a huge advantage. What's interesting is that Microsoft and some of the other providers have sort of been feeling the pressure, if you will, and now you'll notice Microsoft Teams having many of the same features of multiple windows, breakout rooms, and all that kind of stuff. So it's interesting that I think the market has become very competitive and very aggressive in supporting remote work and remote instruction. So I think a couple of things really I think were about security. So there were a lot of things in the early deployment that were very, very open and very loose, and some things that were very tight. I think as we've worked through the semester, we've gotten a lot smarter about security controls to make sure that people that should be in classes or meetings were, and those that shouldn't be there, you had ways to make sure that didn't happen. So I think there's just some growing pains there. Huge shout out to our partners across campus, our TIPS team and Global Campus and our academic technology team and ITS and the people that do all of the support in the classrooms and labs. We came together as a community and really did a lot to make the classroom experience, the hybrid learning experience, as uniform, as well supported as possible. So it really was a community effort to get that together. So that was really a pretty amazing amount of effort where everybody really worked together to make that a very rapid experience. We look at how fast we had to move off campus and then provide supports for changing instruction. That was just an incredible lift, and people really came together for that. The other thing that we've done in trying to figure out how do we get enough social distancing in our campus spaces. So part of that was work that Terry Martin and several committees on campus were really working with FAMA and trying to figure out how do we actually do that. But then our network team has been working with FAMA as well to increase our green space wireless, we call it. So we've done a massive uplift on Wi-Fi availability between buildings and the green spaces on campus. We're in the process now of adding additional capacity in Lot 56 for places there people might want to connect from their car or things. But if we're trying to think beyond the boundaries of the physical buildings and adding connectivity to other areas. So it's really been about flexibility. And then the other bigger issue, I think, is just realizing that there are a lot of limitations to the community support. A number of faculty, staff, and students have really experienced difficulty with variable Wi-Fi connections or the availability of broadband in the community spaces. And that's an issue that we continue to work on. There are all kinds of regulations and issues with what we can do once we get beyond the campus boundaries. So providing extended connectivity beyond the boundaries of campus is still an ongoing challenge. But one thing that we did do was significantly increase the number of computers that we offer for loan through the STC space in the union. So we've got, I think, 500 computers now that we loan out to really help provide access for students that need to have access beyond the campus boundary. So it's really been more about scaling and getting smart about the security controls, and then trying to do what we can to help facilitate that connectivity as much as we can in a separated offering, I guess you might put it.
Okay. Thank you, Steve. Melissa, let's talk a little bit about our students. This is a tough time for them. There's no question about that, as it is for the campus community at large. And the students right now are not really in the vaccination conversation. When we talk about prioritization, including the survey, only the people receiving the survey and any prioritization consideration are those who are on our payroll. So they don't really, it doesn't encompass students. So if you have to be tied in with HR in some way in order to receive any degree of prioritization. Now that's not our doing in and of itself. That's a state kind of planning and processing. But our students are having a tough time. We know that the request in the past for grade modification was tied to some of the challenges that they've had in this environment. Just recently, we unfortunately had deaths of a couple of our students on campus. So not on the campus, I'm sorry, but associated with our campus. But what I'd like for you to do is just talk about what are some services for students if they're having a tough time right now. Who can they contact to seek some support? You're on mute, Melissa.
I'll drop these numbers in the chat as well as to give them to you. But the first number is to call UA Cares, or even better, to submit a report through UA Cares. You can go to report at uark.edu, or you can go right to U of A Cares, or you can call 575-5006. And someone will return your call, and you can either report a student, you can report yourself, and you can find out what resources are available for you. And I will say, this is a difficult time for a lot of students on our campus and in our community, because we have lost 2 of our students last weekend, and those students touched a lot of lives on this campus. And so if that is presenting a difficulty in terms of how you're coping, then please call CAPS, and that number is 575-5276. I'll drop that in the chat as well. And CAPS can be reached after hours. And it's the same number, 575-5276, and press 1 to talk to a counselor who is on call. So I think those are 2 very good resources. And we're here for our students, and we're here for our faculty, staff who are learning and seeking ways to support students.
Okay, I think, Melissa, only the panelists can see the chat, so we may have to reiterate those numbers in some way at the end of the well, here I have it now, 575-5276, after hours, and press 1 for a counselor on call. That's CAPS 575-5276, and we can send it out to the attendees so that they can have that number to share and distribute and offer support to our students who absolutely need it. I've been informed that that has already been done, so that's great. Wonderful. I'd like to go back to a question that has now come up a couple of times in the chat, and that's looking forward in terms of our students who may receive vaccinations. Will we know? And I guess Matt, Huda, feel free to weigh in. Will we know if students have received these vaccinations? And so, Matt, I guess I see you went off mute, so I think you'll take a stab at this one.
Yeah, so it's important to note that there is no mandate. There's no state mandate. There's no university mandate for anybody to receive the vaccine. So the simple answer is no, we won't know if somebody has been vaccinated. The question that I saw in the chat is it legal for me to ask my students? And I would defer to Terry and Dr. Robinson, but my gut tells me that's not a question that you want to present to the class as a whole. We can't restrict them from coming into the classroom or to an event or on campus if they've not been vaccinated. We can't prevent them from coming to work if they've chosen not to be vaccinated. So at this point, there is no mandate. There's really no tracking mechanism unless somebody tells you that they've been vaccinated to show who has in fact been vaccinated.
Thank you, Matt. I think you accurately responded to that. Terry, you have any comment on that? Anything to add?
No, I just, want to reiterate that the way we're handling our classes of 6-foot separation with the mask, there's still, until we change that mode, CDC, ADH have all said that we are operating our classes in a safe environment. And so to me, that's it. Now, I don't know the legal aspect of, I suspect you would not be able to ask someone about their medical conditions, and who to probably can address that from the HIPAA standpoint.
While you're addressing that, you might as well weigh in on how often will we have to get this vaccine for COVID-19? Is it like the flu shot, or will we have to get it every year?
Sure. So I think Terry's right as far as questioning students. I mean, it is part of their medical history, and how about if they say no? You know, like Matt said, there's no current requirement or mandate. And a part of that has to do with the fact that we can't forget that these vaccines are, you know, thankfully being approved by the FDA for emergency use authorization. And so they are safe, they are effective, but it's under that direction from the FDA. And so they will ultimately get full FDA approval. But that's also a sticking point as far as difficulty making it a requirement. The other issue that the provost asked about, what was it? What were you asking, Charles?
Will COVID-19 vaccines be like flu shots where we have to get them every year, or will they be handled differently? I mean, has that been determined?
So we don't know. They don't know now. Moderna thinks that their vaccine, the immunity against the vaccine, would last at least 1 year, if not longer. But again, a lot of this depends on how long we allow transmission to continue worldwide. As long as we have widespread transmission, that only increases the likelihood of perhaps more mutations. And so, yet another reason for folks to get vaccinated, not only to limit the amount of active disease and infection, also decrease deaths across our country and across the world, but again, to decrease transmission rates, which will then decrease the chances and risks of having more mutations in the future. But what I like to emphasize again is that now that the research is there, and the research for messenger RNA has been in existence for 20 to 30 years. That technology is not new. And so that's the other questions I get as far as, you know, fear factors in getting the vaccine. But that research is not new. The fact that this pandemic has affected the globe has made it possible for more companies to want to start that research, for there to be more funding available for these types of research projects, and to have more people willing to volunteer for these trials. So you put all of that together and you have the perfect environment to have successful research, and then thankfully be able to have successful vaccine. One of the questions that I keep seeing also in the chat, I don't mean to diverge from what the provost asked me, but is, you know, once I get the vaccine, will I just have a positive COVID test forever? Well, first of all, getting the vaccine does not lead to a positive COVID test. If you have a positive COVID test, you have an infection. And so now, can the positive COVID test remain positive well past resolution of the active infection? Yes, it can. You know, once someone has COVID and their symptoms have improved, they've completed their 10-day isolation period, 14-day or 10-day isolation period, they're not felt to be infectious anymore. But the test can linger for weeks, if not months, and continue to be positive. It does not mean that person is still contagious or infectious. We see this with other types of tests. We see this with mono. People who have mono can be sick for 4 to 6 weeks. They're no longer infectious after that period of time, but they can have a positive mono test for up to a year. So again, COVID tests are designed to detect virus, not antibody. So the rapid tests are basically designed to detect proteins in the virus. The molecular or PCR tests, they're designed to pick up the genetic material from the virus. So that's why they're found to be more sensitive than the antigen or protein tests that we hear about.
Thank you, Huda. I always feel like I want to take notes when you speak. Flo, Can we talk a little bit about quarantining and isolation? You know, I know we had a slew of quarantines and isolations over the fall. Where are we now in that process for the start of the spring?
Well, it's slowed down for spring compared to last semester. And we have probably 7 to 8 a week rotating through. And so if a student is positive, they can stay over in Holcomb Hall. If they need to be quarantined, we have a number of places for them to go. One change that has happened is over the last couple weeks, we now have students calling us sometimes before we have the information that they need assistance. So it's kind of a change in the culture that's good to see. We also, thanks to people at the Arkansas Union, have been able to assist those that need transportation to where they're going to stay so that they're not having to carry everything and worry about parking space. And that's been really helpful. And then we've had a number of people help volunteer with the meals because the students are being delivered 3 meals a day. And all of that help and cooperation has really helped it be a good experience. Well, I guess the best experience it can be for students when they're in that situation.
Thank you, Flo. Huda, testing is still taking place regularly at Pat Walker. Can you talk a little bit about volumes?
Oh,
And
sure. Yeah.
you see students coming, or is it largely faculty staff?
So we see a mix of students, faculty, and staff in both locations. We actually have the capability in the back parking lot to do PCR testing on, and it's typically those that are identified as contacts, or maybe they're worried well, maybe they were at a family party and they're just concerned. We saw a lot of this prior to travel. Again, that's the PCR testing that takes about 24 to 36 hours. We have actually the capability in our back parking lot to do over 150 tests a day. In our Garland garage, where we have both physicians and nurse practitioners, seeing patients for all types of respiratory symptoms, whether that's coughing, fever, body aches, whatever the case may be. And we are able to do a rapid COVID test in the garage, as well as if that's negative, we can also run a flu test. We can do strep screens, throat cultures. We have a mini lab over there with nursing and medical assistants, as well as the physicians and nurse practitioners. We have the capacity in our Garland garage to see over 70 to 80 patients a day.
Okay, and can you talk a little bit about, I guess, if you've had the virus, what is the recommendation for vaccination if you've already had?
So Matt and I get this question a lot. The question is like, well, why am I going to get the vaccine? I've already been infected. I have immunity. Well, let's start out by that. They think that the immunity from the infection lasts shorter than the actual vaccine. They think it may last maybe 3 to 6 months before it wanes. So if you've already had COVID, recovered from COVID, you most definitely need to get the COVID vaccine. They feel that you get a stronger immune response, as well as a longer lasting immune response. The other question Matt and I get is, when should we get it? I mean, when is it safe to get the vaccine? It's safe to get the vaccine if you have had your symptoms improve and you have completed your 10-day isolation period. Anytime after that, you can receive your COVID vaccine. And the main reason to not get it while you're acutely infected is because they really don't want people with active COVID infections running around town trying to get vaccinated. So again, if you've had COVID infection, made it through, symptoms improved, completed your 10-day isolation period, you can be vaccinated anytime after that.
Okay, and there was a question about positivity rate on campus versus the rest of the state. Can you comment on that?
What I can talk about is actually, I'll just give the example of our mass vaccine clinic. You know, we held, not mass vaccine, mass testing event that we held about 3 days prior to the start of classes on the 11th. We did a total of about 650 tests at that point, and we ended up with about a 5% positivity rate. which honestly was pretty good. That's basically what I can speak to. Folks are like, are you still seeing positive cases? We do. I mean, we see positives and negatives time to time, but I think overall it's okay currently. But I really can't speak to specifics. I'd be guessing.
Right. Okay, we're in the last few minutes of this forum. I appreciate everything that you shared. I'll remind the listeners that we will respond to your questions if we did not get to them in this forum. But I'd just like to see if there are some parting reminders, words that each of you would like to share with our listeners before we sign off. Let's start with Melissa.
I appreciate all the support that our students receive from faculty and staff for coping with all of the challenges that COVID brings and for going the extra mile with our students. It has really made a difference. And we also want to note that we know the challenge that it brings to the faculty and staff, and that it's very challenging and time consuming. So we really want to thank you and say we appreciate you. We also appreciate our students, particularly our student leadership that has really gone above and beyond to assist us in handling the challenges of COVID. Thanks to all.
Thank you, Melissa. Huda, give us some parting words.
So I remember, Charles, when we had this panel discussion last semester, and my parting words were get tested. So now my parting words are get vaccinated. And so, I get all kinds of questions, and I could speak forever on this topic. But one of the things I'll talk about is folks are like, well, we don't know what the long-term effects are of the vaccine. Well, we kind of know what the long-term effects are of COVID-19 infection. And there are some significant long-term effects, even for those who've had mild symptoms. And there have been studies and there's science behind this, and I would encourage folks to read about it. So anything that we can do to ensure immunity for ourselves and also to protect the people around us without actively getting infected is what we should be doing. In order to achieve herd immunity, and I'll lean on my faculty for this, is that we have to get to about an 80% vaccination rate. And so what I would encourage and ask all of you to do is when you hear misinformation, please correct it, because we need more people getting vaccinated. We don't want to see numbers of vaccine hesitancy that are 40% and 50%. We don't want to see that. We need to learn from history. History teaches us not only about our mistakes, but it also teaches us about our successes. We have had other pandemics. We've had Spanish flu, we've had smallpox, we've had measles. All of these pandemics successfully ended because there was effective vaccine that was administered. So we know looking forward how we can end this. And so I would just encourage all of you, when you hear misinformation, whether it's with friend groups, families, social media, please try to correct it as much as you can, because we need to encourage more people to become vaccinated, and we also need more vaccine.
Thank you, Huda. Steve?
I'll just add a note of gratitude that we did a mountain of work to get people off campus and support them in work and research and learning. So gratitude for all the heavy lifting that everybody did, and just ask for your continued patience and support as we continue to work through this. So the community really proved itself to be a wonderful partner, and I look forward to continuing to support remote work and instruction and research. Thank you.
Thanks, Steve. Terry?
I would kind of echo Steve's sentiment, is the patience as we work through all of this. And I would also like to, as you look through the panelists here, you'll see a lot of people that's put in a lot of hours and a lot of hard work. Thank you for all of that. And I would like to say thank you to a group that we probably don't say it enough or see it, and that's the university relations. Mark Rushing and his team, they clean up our words, the things that we think and how we think we're trying to get the words out. They clean it up and make it to where everybody can understand it. And I would just like to give a shout out to Mark Rushing and his team.
Thank you, Terry. Matt?
So there's a lot of phrases that have been thrown around since this pandemic, but the only one that I will repeat is that it is in fact a marathon and not a sprint. We started planning for this, the planning team and teams, the second week in February, which was the same week that we stopped planning and responding to the mumps outbreak. So we went straight from one to the other. We've been planning and responding for about a year now, and we'll continue to do so until we're back at some level of status quo. So we appreciate all of the folks that have been beside us in the Communicable Disease Outbreak Committee, the team leads, and all of the other groups that have made this response work. Patience is key as we move now into the vaccination. Please understand, we will never purposefully miss somebody, but some people will fall through the cracks. We will get you taken care of. We will plug you into a spot, I promise. We've done that all week. And the last I'll say is, while we speak of vaccinations, we still have infections. Please, 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 when the nurse investigators and the call tracers call you, answer the call and answer the questions. It is imperative that they get that information so that we can identify any potential outbreaks or clusters or groups of individuals on campus that may have been infected as a result of somebody testing positive. So it's of the utmost importance that you answer those calls.
Thank you, Matt. And I'll just reiterate that, there's lots to be disappointed about in this pandemic, and because it's been a deadly one. But the one thing that we definitely can see as a positive is that it takes all of us working together to work through it. And it makes me, I know personally, more thankful for each and every one of you who are working to help the university manage this, and working together and working with that spirit of cooperation. I think is something that we will take forward from this pandemic and hopefully continue to push forward utilizing that. So I think it has helped make us a closer campus, and I'm so grateful for everyone and what they're doing to support each other in this trying time. So thanks to the panelists for listening. We appreciate you and keep working hard towards getting through this, and we will get through it and into brighter days. Thanks, everyone. Have a good rest of your afternoon.